Welcome back. Repeal and replace likely quickly approaching for Obamacare. President-elect Donald Trump has called the plan a disaster. Senate Majority Leader Mitch McConnell promised that repealing the health care law will be the first priority come January 3rd. Joining us right now is Universal Health Services CEO and founder Alan Miller. Alan, great to see you. Thank you so much for joining us.
Good to be here.
So as a veteran of the health care industry in general, you said 240 hospitals in Universal. What's your reaction to this? Should this be repealed and replaced?
Well, the problem is that the good part about it, it covers 21 million people that hadn't been covered before through exchanges, through increases in Medicaid. So that's all good. The problem is that it's hard to pay for it. The insurance companies don't have the young people that they expected. So therefore, the premiums have gone up quite a bit.
Right.
And that's the problem. So you have to try and fix that. But there's a lot of good things in it that both sides say they're going to keep. The children on the policies of their parents till 26.
Yep.
If you have a pre-existing condition, that does not disqualify you. Those are good things.
Okay. So, but it's important for the economy. I had Jonathan Gruber on recently. One of the architects of Obamacare, and he said it has nothing to do with economic growth, and I was just astounded. Michael Jones made the point earlier, well, it is 18% of the economy, health care. So obviously, if it's too expensive and the premiums keep rising, it's going to hurt economic growth, no?
Of course, but the other problem is that you have 21 million people that have coverage. And I can't imagine that any party is going to cut these people off.
Right.
And so what they're talking about is how do we phase in different economies, but we have to have those 21 million people covered.
Which is something Donald Trump said. He said we cannot allow those 21 million to lose coverage at any time.
It makes sense. I mean, you can't. These are sick people or people that need coverage, and how can you do that?
But there's some hospital insiders warning leaders on Capitol Hill that if you repeal Obamacare, it could cause an unprecedented public health crisis. Two hospitals, trade groups, wrote a letter to Trump stating a repeal could cost hospitals $165 billion by the next decade. What do you think about this?
Yes.
I mean, you've got hundreds of hospitals. Right. Do you agree with that?
Well, what happened was, in order to get Obamacare put together, hospitals had reimbursements reduced. We were then told the trade-off was, we'll review some of your reimbursement will be cut, but you get 21 million more people who will have coverage, and so it will impact your bad debt positively. Same thing with the insurance companies. They were supported so that they could cover certain mandates. And now, if it were to be repealed, which I doubt, I mean totally, then you have to take the cuts that the hospitals willingly absorbed, and you have to put them back.
Okay.
And that's what they're talking about.
So you're saying the hospital industry is going to see a huge drop-off in revenue if this comes to pass?
Well, if it's totally repealed and the cuts are not restored.
Right. But you're not worried about that?
Look.
Because Donald Trump has said those two areas that you said are really critical will stay.
Well, because he's sensible. The other thing is we are in every state. We're in every congressional district. A hospital probably is the biggest employer in every area. A hospital is part of the economy. We have to be efficient. We have to have modern equipment. We have to have trained staff. And you can't cut our reimbursements way down and expect the American people will be properly served when they're in need. It just doesn't make sense.
Now, you recently purchased adult mental health care firm Cambian Group, PLC, for $479 million. Tell us why that was an important, and is the price tag $479 million?
Yes, but we bought the adult portion of their business. There were two parts.
Okay.
And we bought the adult portion, which is very successful, and it's growing. And we have a business there now. We have Signet, we have Alpha. We put together a really wonderful business in the UK. And this adds to it, very complementary. A lot of people wanted this company.
Wow.
And they selected us. Yeah, I mean, obviously we paid for it, but the management supported us. Our people are very excited about it. We hope to close by the end of the year, and I'm very excited.
That's terrific. Yeah. Congratulations on that. Alan, yesterday the stock price traded down significantly following an investigative report by BuzzFeed.
Yes.
I want to ask you about this. This article is alleging that psychiatric patients were kept longer than they needed to bill the insurer just to make money. How do you respond to this?
It's highly inaccurate. I read it briefly. It's a long article.
Yeah.
It's highly inaccurate. We're answering it. Also, the writer really didn't have an understanding of clinical procedure. I mean, it's mostly doctors and government and hospital that deals with a patient and the length of stay and what they're referred to in the coding. So it's really an inaccurate.
So in other words, it's not going to be administrators at the company that's going to decide how long a mental patient is staying at your hospital.
Not exactly. The other thing is they interviewed people who no longer work for the company. I mean, we have 70,000 employees. They interviewed 170 people or something like that.
Right.
And it's inaccurate, and it really is.
All right. Well, we were watching it because it did impact the stock. Universal Health, where does the growth come from in the next 3 to 5 years? We know there's been an incredible amount of hospital consolidation. Does it come through more consolidation, or is it organic growth?
Well, it can come through both. You know, the other thing to remember is 10 million people a year a month, are getting into Medicare. 10 million or over 65.
10 million a month.
Yeah, so they get older. They tend to use hospitals more. They see doctors more. And that's the inexorable growth of the population, and then we serve them.
Yeah.
So
that's sort of an ongoing margin or an ongoing dividend.
That's why we see the future positively.
Alan, great to have you on the program.
Good to be here.
Thank you so much. Alan Miller, CEO, Universal Health.